go. Hello, you are listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Our guest today is Patrick Holford. Patrick Holford is the founder of a wonderful organization that you need to know about, foodforthebrain.org, the author of 40 books, and including Upgrade Your Brain. Welcome, Patrick Holford.
Good to see you, Catherine.
So we've interviewed Patrick Holford many times here at the Natural Healing Show. So definitely go back and listen. He's got some great suggestions about how you can prevent dementia. Now, what we're going to be talking about today is how to get off psychiatric medication, because so many people in our society are taking psychiatric medication to heal depression, anxiety, ADD, and many other conditions. So Patrick Holford, as the founder of foodforthebrain.org and the author of many books about how to heal your brain naturally, when someone comes to you for advice about how to get off psychiatric medication, what are some of the first steps you advise them to take?
Well, it entirely depends on the medication and the conditions therein. And it should be said completely at the outset that some of the medications, for example, for schizophrenia, the very last thing you want to do is to come off them quickly. And some people may even need them. But in a sense, and I wrote a book on this called How to Quit Without Feeling S star star T, every addictive substance mimics a neurotransmitter in the brain. That's how it works. So we think that heroin takes over the the natural opioids. And a lot of psychiatric drugs are just like that. So what happens is the longer you're on them, the more dependent you are on them, and generally the less well they work. So if we take, one of the most sort of known, which is the antidepressants, and particularly the Prozac generation, the serotonin reuptake inhibitor drugs, SRI, serotonin reuptake inhibitor, they are affecting serotonin by preventing it from being reuptaken, recycled, or reused. So you actually get a bit more of a serotonin kick, but you can't recycle it. So the natural consequence of that is that you will become depleted in serotonin. And there's been, by the way, a lot of sort of kickback against the story that Pharma told, which is you are depressed because you've got low serotonin. We have a drug which will increase your serotonin that will make you happy. And of course, when Prozac was launched, the idea was put it in the water supply, everyone will be happy. And there's been a bit of a kickback that's, generally not everyone who's depressed is low in serotonin. So it was a story. But a story we should really talk about a little bit. But what happens is when someone's been on antidepressants for a period of time, and let's just say a year or more, they're going to be serotonin depleted. And therefore, if they just stop, they're going to get the effects of a massive deficiency of serotonin, which can make you crazy, anxious, can't sleep, stressed, all these kind of things. So the first rule is to understand how the drug works. And the second step is then to understand what you have to do to get the brain working again so you don't have these appalling adverse reactions on quitting, which are sometimes called discontinuation, and some people would call them withdrawal. In other words, if it really is withdrawal, we could potentially classify these substances as addictive.
Yes, and Patrick Holford, as a medical intuitive healer, I frequently see people on more than one psychiatric medication. Often one doesn't work, so then they're taking two, then they're taking three, then they're taking six. And I see people and their brains are just completely overloaded with psychiatric medication. Now, if you look on the internet, there's different organizations that have information about how to get off the psychiatric medication. And one common recommendation is to withdraw slowly, like about 10% a month. So if someone is serious about withdrawing from psychiatric medication, how slowly would you recommend they actually go off?
Well, I mean, that is all good, but it reminds me of a saying by a wonderful woman who worked in addiction recovery. And she said, if you've scrambled your brains, sitting around in a group and talking about it won't unscramble your brain. So, so it's a little bit like if you quit an addictive substance, do you want to just quit and jump off a cliff? Or would you like to just slowly, get off that cliff? So it's no different for smoking. So from my point of view, the absolutely critical thing to understand is what needs to be replaced. So I'll give you a couple of examples here. So antidepressants that work on the serotonin reuptake inhibitors will deplete serotonin, which is made from tryptophan, which is an amino acid. Everything in your brain and body is made from food. That's the way it could be made. And the most potent form of tryptophan is called 5-HTP, 5-hydroxytryptophan. So personally, I would never recommend, and of course I'm not a person's doctor, so it's something they would have to discuss, anyone trying to get off antidepressants without supplementing very specifically 5-HTP or tryptophan, and there are a few other nutrients that work. You mentioned something really interesting and potentially devious. That is that in the old days, you were diagnosed as depressed. And somewhere along this path, and if I was feeling low and depressed and went to the doctor and said, yeah, I've lost it. I don't know what the meaning of life is. I'm feeling, very low and so on. And they say, how are you normally when you're not depressed? I say, well, I've written 40 books. They say, oh, you're bipolar. You're bipolar. So we had this period of time about 15 years ago where rather than having a lot of people with depression and very, very few bipolar, we started to get loads with bipolar. Now, why is that significant? Well, it's significant because a lot of the antipsychotic drugs, and we're talking here about mania, schizophrenia, etc., they're going to work on something called GABA. GABA, everything that makes you relax, sex, marijuana, alcohol, Valium, it's all promoting GABA. So the brain makes GABA, which happens to be both a neurotransmitter and an amino acid. So in America, but not in the UK, you can go into a health food store and you could literally buy GABA, an amino acid. And if you take it like 1,000 milligrams, that's quite strong. It's quite potent. Even 500 milligrams, you relax. It's sort of a bit like, and remember, this is why people drink. The main thing is you're feeling stressed, end of the day, you have a drink and you relax and you stop thinking about all those things that make you anxious. That is the effect of GABA. So if you can switch people from depressed to bipolar, you can now prescribe them both an antidepressant and a mood stabilizer because the antipsychotics got reclassified as mood stabilizers, right? So now you've actually doubled your drug sales. And this is literally, what's happening. And if you do go to the doctor and say it's not working and I'm still not sleeping, I'm still anxious, I'm still depressed, whatever, they say, let's give you something else. you know. Uh, and yeah, this does tend to be the way. It's polypharmacy, and after a while, your brain is so scrambled, you don't really know what's going on. So yeah, if at that point you just decide I'm going to, reduce slowly, slowly, that's a good idea. But I would strongly recommend first getting your brain back into order. And by the way, in the How to Quit book, there are kind of 12 steps, but one, which I know we've spoken about before, is to measure the blood level of something called homocysteine, which is very much to do with B vitamins. And you can't make neurotransmitters without B vitamins, and you want that homocysteine to be low, like 7. So if it's raised, your brain's out of whack. Another, omega-3, very, very, very important. Another, sugar, because sugar itself is an addictive compound and affects certain neurotransmitter pathways. So in other words, I'll give you the analogy of a smoker. Smoking affects your blood sugar. So if you just decide today I'm going to quit smoking, the odds are you're not going to succeed, because when the withdrawal effects kick in, you're desperate for a cigarette. So first of all, you get your blood sugar stable, you get your diet good, you get the homocysteine down with B vitamins if you need it because you've tested. You get the omega-3 level up. If it's depression, vitamin D, no brainer. We know the link is massive. So in other words, you work around the edges to get everything healthy, and then you might start to reduce the medication. And if it happens to be a GABA-based medication, then GABA will help. If it's a serotonin-based medication, serotonin will help. And by the way, these new antidepressants, because when a drug runs out of patent, usually after about 15 years, then what happens is there's no money to be made. So the SRI, serotonin reuptake inhibitor antidepressants, they're like old school. And the new ones, which have a patent and therefore more profitable, duloxetine, Effexor, Cymbalta, these are called serotonin and noradrenaline reuptake inhibitor. So we'll talk about that little adrenaline, noradrenaline area because there's something else to do there. So in other words, get the bases covered, find out the mechanism of the medication you're on, and then work out how to restore that pathway. It's a process.
So Patrick Holford, what I always find interesting about psychiatry profession, let's say you had a cholesterol problem, well, you'd go to the medical doctor and they would actually measure your level of cholesterol. And, that's a whole other discussion because we've done shows about Lipitor and how it doesn't really work. It's really great for the drug companies, but the statin drugs are not necessarily good for you. But the point is, the medical doctors would measure. But when you go to a psychiatrist and you just tell them you're depressed or you're anxious or what have you, they just give you drugs without testing anything. So
Well,
what? Mhm.
yeah, it's a total mismatch because on the one hand, you're diagnosing the condition on the basis of a psychological test or questionnaire. For depression, it's usually called the Hamilton Rating Scale of Depression. And then you're treating it with chemistry. And usually, in the same breath, if you say, has diet or nutrition got anything to do with it, which of course is chemistry, they go, oh, don't be so ridiculous.
Don't
So
be-
you're right. It's a complete mismatch. So when we have people who are depressed, we actually, I mean, it's very cool at the charity Food for the Brain because we've now got a home test kit. It's called Drift. It's dementia risk index functional test. It measures your homocysteine, your omega-3, your vitamin D, your HbA1c for your sugar balance, and something called glutathione for antioxidants. So, if you came to me and you were depressed, I'd actually measure these things. And if you are out of balance, it lets you know what to do in terms of food, supplements, and so on. And
So,
then very often what happens is, the depression goes away.
so Patrick Holford, so many people who go to a psychiatrist who's prescribed medication, they're actually told you have a biochemical imbalance in their brain. And so, so many people buy into this story that they have a biochemical imbalance in their brain. What does the research show? Is it actually true that the brains of people with anxiety and depression, are they actually different from everyone else? Or are they actually different? What does the research show?
Well, there's a very good psychiatrist in the UK who's really drilled down on this whole idea that people who are depressed are low in serotonin. And her research shows overall, this is not true. Overall.
This is not true.
Overall, it is not true. So you can't, and actually, there's a real problem here, which is that serotonin is very hard to measure accurately. And the reason why I say overall is I'm not practicing anymore, but when I was, I found that there was only one test that was accurate for serotonin, and it was called it measured the level of serotonin platelets, which are tiny things in the blood. And and if it was low in the platelets, it was low in the cerebrospinal fluid of the brain. So what we would do is to measure that in our patients, and if they were low, then we would give them 5-HTP. Similarly, if they were low in omega-3, we would give them omega-3. If they were high in homocysteine, we would give them B vitamins. You don't have to always measure the sugar thing, HbA1c, because you could tell from their diet, and we would generally advise a lower carbohydrate diet. So it's not consistent, and nor is it with. I mean, it's a similar parallel to. I mean, I'm 67. Two-thirds of heart attack deaths in the elderly are predicted by high homocysteine, not cholesterol. So there are loads of situations where someone has a heart attack, their cholesterol is not high, and they're put on a cholesterol lowering drug. So I generally would say do not assume that because someone is depressed that they are low in serotonin. They may not be. But the same is true like with vitamin D. We know that low vitamin D increases risk of depression. It doesn't mean that everyone who's depressed is low in vitamin D and will benefit from vitamin D. Omega-3, 26 studies pulled together into a meta-analysis show generally giving omega-3 reduces depressive symptoms by, I think, 28%, generally. But again, it doesn't mean that omega-3 is going to work for everyone. So if you actually understand, we're talking about chemistry, find out where the imbalance is, correct it, then your success is so much higher.
And with that, let's take a break and listen to a message from one of our commercial sponsors here at UK Health Radio. My name is Catherine Carrigan, medical intuitive healer. We're listening to Patrick Holford, the founder of foodforthebrain.org. We'll be right back. So, Patrick Holford, two of my 10 books are about how to heal depression naturally without drugs. The most recent is called Banish the Blues Now by Catherine Carrigan. Will you share for our audience the name of your book about how to get off antidepressants and psychiatric medication? And then you held up another book. So let's
Yeah, well,
everyone.
I have a book called How to Quit Without Feeling Shit, S star star T. And I want to tell you a little bit about the story of that book because it does cover antidepressants and many medication, but also alcohol, cocaine, heroin, sugar, nicotine, everything. And what happened was that there was a wonderful doctor and also a professor of addiction studies. And they had incredible results by measuring someone's neurotransmitters and then creating a drip intravenous of the amino acids that would restore that balance plus nutrients like omega-3, B vitamins, and so on. And they came to me and said, "Would you please write this? Because you know how to write." And they presented me with literally 2 suitcases full of the scientific research. And that's how the book came into existence. And one lovely example was they went to a treatment center for addicts called Bridging the Gaps on the East Coast of America, and said to the proprietor, "We don't want to change what you're doing." I think it was 12-step based, nice food, exercise, counseling, etc. But what we want is give us a couple of dozen of your patients, if they're called that, and we're going to measure their blood and give them an intravenous drip tailor-made for to restore their brain chemistry for 5 days. That's like a 2-hour drip every day for 5 days, and then a package of supplements for 30 days, and we're out of there. And all we want is for you to tell us in 1 year how many are clean and sober. And they had 23 people were enrolled in this. And at the end of 1 year, 21 were clean or sober. And I think 18 had continuous sobriety, not one change. So those results are phenomenal. And it is a real tragedy that that's not really used much in this kind of addiction process.
So in my 31 years in natural healing, as just as you, I've worked with nutrition, both food and supplements. Are there lab tests a person can do to determine whether or not their brain chemistry is actually healthy?
Yeah, I mean, first of all, the basics we spoke about: homocysteine, omegas, vitamin D, blood sugar. All of those are really important. But
And you can do that test through foodforthebrain.org. And I want to give
yeah, food for the
plug.
brain. Yeah, foodforthebrain.org. You click on tests, you get the home test kit, you do it. It's available throughout the States, Canada, UK, EU, Japan, Australia, just about everywhere. So that is really easy. It costs you a couple of £100, bucks or something. That's very easy. There are tests that go a little bit further and measure the neurotransmitters, or often the metabolites of neurotransmitters. And the point there really is these neurotransmitters in your brain, and the most accurate measure would be the cerebrospinal fluid in the brain, but you have to do a lumbar puncture, and no one's going to do that. So sometimes there are tests that look at the breakdown products of these amino acids. So you can get a little bit, closer into it. In my book, How to Quit, depending on the nature of the substance, you can actually see what is going to help you. So, for example, I mentioned before that the new antidepressants are called SNRI, serotonin and noradrenaline. In America, it's called norepinephrine.
Mhm.
Serotonin and norepinephrine reuptake inhibitor. So now there's a family of neurotransmitters: adrenaline. So we think stimulating, noradrenaline. Sometimes they say adrenaline is more like fear, and noradrenaline is more like the sort of love. I mean, the stimulation of a sort of very positive feeling. They're both made from dopamine.
Mhm.
So these are all stimulants. So when you have a cup of coffee, for example, this is what you're stimulating. If you have cocaine, this is what you're stimulating. And so the idea of the SNRIs is they're not only going to sort of somehow affect your serotonin to give you a boost there, but also your noradrenaline to give you a boost there. But what they do is they inhibit the recycling or the reuptake of noradrenaline. So now the withdrawal effects are twice as bad. And it's terribly sad because people have been told, "Oh, no, 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 stop that antidepressant. We'll give you this new antidepressant," which of course is patented, so there's more profit. And as far as I can see, the withdrawal effects are, significantly worse. And it's a real tragedy. Now, when I look in the scientific literature and what's happening in the world of pharma, I find papers proposing that if they gave the antidepressant, like a serotonin-based antidepressant, with 5-HTP, the the drug works better and the side effects are less. So no one's quite produced this enhanced drug, partly because if they did, it's like an admission that the 5-HTP works. So yeah, I was showing you. I know not everybody, watches this as a video, but a book, Chemically Imbalanced: The Making and Unmaking of the Serotonin Myth.
And
And
who's the author of that book?
it's Joanna Moncrief. She's a professor of psychiatry. It's very good, but here's the issue. It sort of basically says, depression's got nothing to do with serotonin. And yet it's not true because it's a generalization. There are definitely, number one, some people who do have low serotonin. And also, and that is admitted in the book, after you've been on antidepressants, you become more serotonin depleted. So, never mind the theory, does something like 5-HTP work? And again, there are about 30 studies now, placebo controlled studies or studies comparing antidepressant drug to 5-HTP, and it is at least as effective. And I
So,
read yeah. So in other words, it's a little bit like, what I was saying with omega-3. When they pull the studies together, it is effective, but it will be more effective in those who are low in omega-3. 5-HTP is effective, but it will be more effective in those, who are low in serotonin.
so Patrick Holford, my first 10 years out of 31 years in natural healing was learning all about how to heal the brain. And in my office, in my healing room, I have a little test kit of 25 neurotransmitters. And it's very interesting because nobody has the same brain chemistry. You could have 25 people with depression or anxiety, and all their brain chemistry would be completely different. So I want to just go back to one of the fundamental principles of natural healing, which is biochemical individuality. Now, Patrick Holford, why is our brain so dependent on nutrition? Why is what we eat and what we put in our body actually important?
Well, the brain consumes a vast amount of energy, way more than any other part of the body. It has more mitochondria, which are the energy, producing factors, if you like, within our cells. So it consumes glucose, sugar, fuel. And what a lot of people don't realize is that something like 60% of the brain is fat, the dry weight of the brain. And the membranes, so you've got these neurotransmitters with like chemical messengers, which dock onto a receptor site within the membrane, within, if you like, the skin of the neuron. And it's through that all the talking happens. But actually, that membrane is made of mainly omega-3 DHA. DHA is a fatty acid that's very rich in marine food, oily fish, for example. And there's also arachidonic acid, which is a plant-derived omega-6 fat. But what happens is, it's not just that they are like the sort of the door that opens and allows the message through. The change in the shape of that omega-3 DHA is the message. It is the message. It's the code. In the same way that anyone in computers knows that everything that we talk about in programming is just an arrangement of ones and zeros. It's just a combination of ones and zeros. That's what the talking is. And there's a very interesting conversation to be had about, are we digital? Because our neurons, they either fire or they don't. Are we digital in the same way? And similarly, that message changes the shape of the DHA. And I believe, by the way, and that creates a lot of oxidation. And oxidation means you need antioxidants, fruit and veg, and vitamin C and so on, and vitamin E, very important antioxidant for fats. Then at night, that those sort of, it's almost like, Morse code, those signals have to be reset. And I believe that a lot of the content of dreaming is sort of the resetting of all these neuronal signals. It's almost not, it's not as linear as your day in reverse, but there's an awful lot of stuff that seems to occur in your dream that has some relationship to things you processed, the day before. So the point is, this is like, it's a ton of energy, a bit like your computer needs a backup. And the very, very fact, by the way, that every single mammal has to sleep. We cannot function without sleep. Sleep is vital. So why? What's going on? And the answer is that in sleep, you're literally resetting all those signals, and it consumes a ton of energy. There's a
So,
point I want to make, which is slightly different, and it's very important because I don't believe that everyone, for example, is depressed because they lack omega-3 or have raised homocysteine or B vitamins or sugar and so on. And very often we become depressed because we're not living our life true to who we are. So
mm,
we're betraying ourselves. For example, or we're really angry about something and we can't express it, so we take it inwards as depression. Or we got a shit job or a shit marriage or a shit set of circumstances. In other words, people are often depressed because depressing things happen. So that might lead you into depression. In the
mm.
same way, it might lead you into drinking too much alcohol. So the psychosocial things that lead someone into a state of extreme anxiety, depression, or whatever, possibly now with drug use, whether recreational or medical, actually. The point is that once the brain is scrambled, you have to unscramble it. So, in other words, you might solve your marriage, you might solve your job, you might solve all these things, but still you don't feel good because your brain has become deranged and you need to rearrange it.
Great point. Now, Patrick Holford, some purists in natural healing might say, I can get everything I need from food. Is that actually true? Can we actually get everything we need to heal our brain from food? Or, in your opinion, your professional opinion, do we really need to take supplements?
Well, they're really missing deep thinking. The reality is that we only became human because of a set of conditions that changed. So we know 6.5 million years ago, our ancestors split from bonobos, gorillas, chimpanzees. Their brain size has not changed in 6.5 million years ago. This is done on skull size, around 350 grams. And ours got bigger and bigger and bigger and bigger and bigger and peaked at just under 1,700 grams. So we're looking at 4 times the size around 30,000 years ago. And now, by the way, our brains are getting smaller. We've lost 20% of brain mass. Homo sapiens today, 21st century, has an average brain size of 1.35 kilograms, not 1.7. So we're losing brain mass. The question is not the genes. We're only 1.53% different in our genes to the gorillas. And it must have been a change in the conditions of existence. Now, I'll explain what I mean by that. Obviously, humanity, as they migrate out of Africa, has to do it along water because we need water. It's just essential to have water. Now, where I live in Wales, in the Gower Peninsula, not far from where I am, they find a 40,000-year-old Homo sapiens skeleton. They assume it's a woman because there's all this beautiful jewelry and necklace of shells made out of shells. Turns out it's a man, and it turns out that almost a quarter of the diet is marine food, seafood, marine food. Now, of course, they would have been expending double the calories that we do because they got to hunt and gather and get wood and, all that sort of thing. So if they're expending double the calories and therefore eating twice as much, and almost a quarter of their diet is marine food, which is incredibly rich in omega-3, vitamin D, phospholipids, B12, zinc, iodine. Every single one of these nutrients are very strongly related to mood, for example. I would have to have half of my entire diet as marine food because that was the easy food. You don't have to go hunting. You just pick up a mussel, a crab, the little fish caught in rock pools. I mean, it's easy. Oysters, abundant. Very few people. Ester is pumping, with fish. So very easy food. So the point is, can you get all the nutrients you need from a well-balanced diet? Absolutely. If you live like Homo sapiens lived for 6 million years, across which we became Homo sapiens, eating a very high marine food diet, plus plant foods, all organic, and twice as much food as you eat today, then yeah, I reckon you could do it. But you know, but in real terms, when I want to supplement, I am literally supplementing to the level of what my ancestors will have got in just about everything, with the one exception of vitamin C, because us poor apes have lost the ability to make vitamin C.
And
And for
with that, let's take a break and listen to one of our commercial sponsors here at UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author. I'm the author of the most recent book, Banish the Blues Now. And Patrick Holford, our guest, has published the book, How to Quit. We'll be right back. Patrick Holford, some of the latest studies about walking show that we need to walk at least 3,800 steps per day to prevent dementia and 7,000 steps per day to prevent depression. Why is exercise so critical for healing the brain?
Well, it does stimulate endorphins. So, when you hear about the runner's high and so on, but there's a lot else, going on in exercise. In relation to dementia, we actually know that your muscle mass predicts your brain mass. And one of the things that happens when you exercise is you start to circulate blood and blood rich in nutrients. So it's literally that extra circulation of nutrients into the brain through exercise. That's a big plus. If you happen to do it outdoors, and if you're going to have, 4,000 steps or something, you're likely to be outdoors. Then, as long as it's not the winter months, you'll be getting a bit more vitamin D as well. And vitamin D is made in the skin in the presence of sunlight. Sunlight also stimulates serotonin. So now you've got a serotonin effect. If you happen to do it in nature as well, then you've got a bit of a nature effect. And unfortunately, all our running shoes and so on are sort of plastic or rubber. So you don't get earthing. But actually, there is an earthing effect when you sit on a stone or touch the earth or so on. And very often, there was a lovely book by a lady called Laurel Mellon called Wired for Joy. And I love that book. And one of the things that it kind of identified is sort of 5 states where the best is joyful and the worst is total freak out. And her very good point is all the things we love, like, mindfulness and meditation and take your supplements and eat a healthy diet. When they're great, but when you're freaking out, you can't do that. Like, I love heart math. Heart math is you clip this thing on your ear and you're recording, if you like, your stress state. It's called your heart rate variability. And you start to breathe into the heart. You imagine you're breathing into the heart space, and you can actually watch this change. You come out of stress. And then you evoke a very, very positive, emotional feeling or memory. Maybe think about someone you love or an incredible achievement or a wonderful place or whatever. But the point is, when you're freaking out, just breathing into the heart is probably as far as you can get. You
No,
know, you,
Patrick Holford. So we're talking here about today about how to get off psychiatric medication. And yet many people have been on psychiatric medication for years, if not decades.
yeah.
When a person has been taking psychiatric medication for years or decades, what does that actually do to their brain? Because so many people just think, well, this is normal. This is how it's supposed to be. What does
Yeah.
it actually do to the brain?
Let me tell you. But just finishing that very last bit, the point is that what I often say, she has three rules, by the way. One is um, don't judge, because that's what happens, minimize damage, and it will pass.
Mm.
So, what I say to someone when they're freaking out is go for a walk in nature. Right.
Yeah.
So, sometimes just taking that space, allows you to process things, calm down, and so on. So, here is a very, very important question you ask. And the answer is there are no studies that have looked at the long term effects of these medications, antidepressants, antipsychotics, and so on. We know that the antipsychotics for schizophrenia are remarkably ineffective. They don't have a good track record in terms of, I always call them chemical straitjackets, perhaps necessary if someone's totally freaking out and you've got to bring them down and ground them and so on. But if you look at the actual results, don't know. So one of the tragedies I find, because I actually came into this field originally from working in schizophrenia, is that even the nutritional things are less effective in someone who's been on potent antipsychotic medication for many, many years. And I know from my wonderful teacher, Dr. Abram Hoffer, that if you could only get in there at the very start, in other words, we call it drug naive, when someone's recently been diagnosed or had a breakdown or whatever it is, and then do all the wonderful, not only nutritional, but lifestyle things that, support them, you get tremendous results. But if someone's been on medication for 5, 10 years, it's very, very hard. It's very hard. You can get improvement, absolutely, and all the nutrition is tremendously important. But you got to remember that these antipsychotic drugs, which are dampening everything down, this is the GABA effect. What happens is when someone's on those medications, they feel so sort of zonked, they need stimulants. So they're going to lean on caffeine. They'll start drinking a lot of coffee, a lot of tea, smoking a lot of cigarettes, having a lot of sugar because they're trying to get some pulse, numbed by these chemical straitjackets. So now they're caught in this cycle. They give them
Okay.
the yeah,
So
and
Patrick
that's
Holford, we only have
that's what
time,
you have to break. That's
we
what
only
you.
have time for one more question, unfortunately. As you know, our neurotransmitters, our brain chemistry, as you're well aware, are made from amino acids, the building blocks of protein. If someone is a vegetarian or a long-term vegan who has mental health problems, I see this all the time in my practice, where somebody is not eating meat, they're vegetarian or vegan, and they have mental health problems, what would you advise them to do? Our last question for today.
Well, you can get the amino acids from quinoa, from soya, from beans, and if you're vegetarian but not vegan, eggs, fantastic protein source. So you don't need to be protein deficient in that context or amino acid deficient. Much more worrying is actually the potent omega 3s and definitely B12. We have an epidemic of B12 deficiency. The reference range, by the way, in the UK and the US is quite wrong for B12 when it's measured. It's a fraction of what it is in Japan, where it's about 4 times higher than normal reference range. So a lot of us are B12 deficient. And if you lack B12, so if you're a vegan, for example, or and you do not supplement B12, you are going to be deficient. And if you're deficient, you can't do what's called methylation. Your homocysteine will go up and you become quite disconnected. So, is the rate of schizophrenia higher? Yes. Depression high? Yes. Autism higher? Yes. Dementia? Yes. In vegans who do not supplement B12, or vegetarians who do not supplement omega-3, because as much as I love chia seeds and flax seeds and walnuts, which contain alpha linolenic acid, a type of omega-3, is fantastic foods, very little of that becomes omega-3 DHA. So you can get a straight line correlation between seafood consumption and mental health for just about every condition. So yes, vegetarians and vegans, I read a book on that called Optimum Nutrition for Vegans. If you're going to do that diet, you've got to get nutritionally sussed, and you will need to supplement B12, probably omega-3, and phospholipids or choline, which is terribly important. It's in eggs, it's in fish. There's virtually none, a little bit in broccoli, a little bit in almonds. So yes, vegan, vegetarian, you've got to get sussed, and you certainly have got to get some supplements.
You've been listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. You can find out about me at catherinecarrigan.com and unlimitedenergynow.com. Our guest today has been the wonderful and brilliant Patrick Holford, author of 40 books, including How to Quit, and founder of foodforthebrain.org. And remember, it is possible to get off psychiatric medication by working holistically. It takes time, and you can find out more about how to do that in my book, Banish the Blues Now, and in Patrick Holford's book, How to Quit. So remember, you can heal your brain naturally and feel good naturally. Thank you so much for listening, and we'll see you next time.